Hi, it's Dr. Steve Messineo, owner of All Access Physical Therapy with clinic locations in Shrewsbury, Sterling, and Marlborough, Massachusetts. And today I'm going to provide some tips for those of you who are staying home, staying safe during this coronavirus pandemic. Appreciate that you're doing so, and we want to offer you some tips on different ways to help yourself overcome any injuries or pains you're dealing with at home through the series of videos we'll be sharing over the next couple of weeks as we all get through this pandemic. So stay tuned. All right, so in today's episode of home PT techniques you can utilize on your own during this COVID-19 pandemic, what I'm going to do is demonstrate a couple of exercises for people who have low back pain but feel more comfortable when they're actually forward bending or when they're sitting. So stay tuned and I'll demonstrate those for you. Okay, so if you're feeling some back pain and you feel more comfortable in either sitting or when you're forward bending, then what you want to do is you want to continue to promote that in order to help you relieve your back discomfort, especially when you stand back upright. So one of the things we recommend typically is for people to do what we call a crash position stretch. All right, so what you're gonna do is you're gonna sit at the edge of a chair, feet wide apart. You're gonna take a deep breath in, and then you're just gonna blow it all out as you let your body hang over toward the floor. Okay, so you just breathe it all out, and just let your body bend forward with gravity. And basically, you want to hold that for maybe 5-10 seconds. All right, you want to do that 3 or 4 times. Straight down the middle, and then what you can also do is incorporate going to the side. So again, deep breath in, and then you're going to reach over both hands over one side of one knee, and again, let it all out, and let this thing open up on the side, and a little bit of rotation in your back. All right, you can do 3 times to the left side, 3 times to the right side. You should feel pretty good after doing this particular technique. Even if you don't have back pain and you just have some stiffness, this is a great exercise you can do on a daily basis just to loosen up your back and get more mobile. Another exercise, if you feel like you're getting cramped on one side, for example, then what you can do is actually do a side bend stretch. Same sitting position, all right? You're gonna take the one hand like this and then bring your other hand over your head, deep breath in, and then blow it out, and just let your body hang toward the side with gravity. All right, come back up, another deep breath, and let it down again. Now you should feel like you're getting a little more range of motion each time. So if you do it 3 or 4 times each side, again, you'll feel like things are opening up and you're getting more mobility. Finally, you also want to make sure that you incorporate some sort of core strengthening exercise with this activity. And so what I typically recommend is you can either do planks or modified planks. And if you haven't done a plank before, I'd start with a modified plank. So it's real simple. You just get onto your knees like this, get onto your elbows like into this position. All right, and you're just holding this while you activate your abdominals. All right, and you want to make sure you're not arching your back because that actually might hurt if you have what we call flexion bias. So you want to make sure your back's nice and straight, comfortable. Hold your abs. Just hold for a count of 10 seconds, then come down and relax, come back up, and you can do that anywhere between 5 and 10 repetitions of 10-second holds just to kind of start firing your abdominals and getting some core stability. So try those exercises on your own. If you have any questions or you're still feeling uncomfortable with your low back or having pain, remember we are offering telehealth sessions for all patients and new patients that are fully covered under insurance by the state mandate during this COVID-19 pandemic. So if you have an interest in giving us a call, 508-845-3500, that is, we'll be happy to schedule you for a telehealth session and get you feeling better. We have a lot of things we can show you over the internet that we think will be beneficial to you no matter what your injury is. So thanks for watching, and we'll see you in the next video.